Well, all you have to do is scroll social media and you see them. We're talking about conspiracy theories and misinformation ranging from 5G cell towers to Bill Gates.
Although it is hardly new, in this instant information age, it has only gotten worse. In this News 5 original, Jordan Vandenberg takes a look at how the issue is playing out in the age of COVID-19.
Information is like a highway. Facts and anecdotes moving quickly and freely at breakneck speed. But like a crash during rush hour, misinformation can bring it to a grinding halt.
To have this misinformation spreading so easily at a time when we have a virus that's also spreading so easily, it's really up to people to stop both.
Jim Sheeler, it's a Pulitzer Prize-winning journalist turned Case Western Reserve University professor. Misinformation is a frequent topic of conversation, both in and out of the classroom.
You want to prevent the misinformation from spreading the same way you would want to wear a mask.
The United States has a long and complicated history with conspiracy theories, and misinformation is hardly a new phenomenon. In fact, the Illuminati conspiracy created hysteria in New England back in 1798. 222 years later, it is no different when it comes to COVID-19.
I think there are a lot of reasons for misinformation, but I think the way that information travels now as compared to even 10 years ago or 15 years ago is very different.
In this age we're in, people are susceptible. And so it's critical that people really educate themselves as to what is real and what isn't real. And there's so much misinformation.
The so-called Plandemic video is a perfect case study. The slickly produced video features outlandish claims as well as a discredited scientist. And yet, within a week of it being released, it had been viewed more than 8 million times and generated 3 million interactions on Facebook alone, according to data from CrowdTangle, a social media analytics tool. It far outpaced any single video on social media at that time, confounding journalists and health experts alike.
The problem with that one, and I think some of the others, is that they're getting more and more professionally produced. The production values are going up, but that does not mean that the information is any more true. And it's even more insidious in a lot of ways because it looks like it's professionally done.
Social media is a different element than we're used to dealing with in pandemics.
The issue of misinformation could likely get worse, especially as researchers work to develop a vaccine for coronavirus. A study published earlier this month found there were nearly 3 times as many anti-vaccination communities on Facebook than pro-vaccination. And those anti-vax groups, the study found, also grew at a faster rate.
The real tragedy of the misinformation and the denials that this is a real problem is it's going to lead to more deaths. And that's awful.
Information comes to us at breakneck speed. And for the same reasons it's up to all of us to keep the roads safe, the same could also be said for these information highways.
It is work, but in the end, it's worth it to try and keep it from spreading.
In Cleveland, Jordan Vandenberg, News 5.